Hello everyone. Welcome to our work-life balance webinar. So it's Friday and we are all ready to prepare for the weekend, and it's very good time to integrate our resources. Today we have a great webinar regarding the mental health issues, especially after COVID time, and we have a great panelist. Here in the work-life balance, always we try to find experts that can help lawyers to cope with this pandemic time, and especially to integrate their resources, well-being resources in their practice. Today, I'm honored to present our panelists, that they are experts and they have a lot of resources to share with you. And our first panelist today is Steve Wolt. Steven is executive CEO of the company Veritus, and he created this institute of substance recovery from substance disorders, Veritus, because he had expertise in this field, struggling years and trying to manage his career and putting together treatment for recovering and realizing that additional treatment resources were needed for executive and highly functional in the workplace. So for sure, Steven, we're gonna bring you a lot of resources from his expertise, from the Veritas resources, and he will present you all the instruments to cope. So I have this privilege to make this introduction for Steven. So we thank you so much, Steven, being here. And the next panelist is Alina Sherban. She's a lawyer and psychologist, and after 20 years of practicing law, she decided to change the path and to go through this mission of helping lawyers. After having her law office and being burned out, she gained experience in managing well-being in the law industry, because especially in this period of time where law industry is facing an overtime and a lot of loss of fear and a loss of income and fear are triggering the mental health conditions. So many lawyers are increasing levels of alcohol and drug use and insomnia, anxiety. And Alina, she has this ability to help lawyers to cope with this period of time. And also we have our panelist Malcolm McNeil, that he's a partner of Aaron Fox, and thank you, Malcolm, for being so supportive in our work-life balance. Malcolm is a great leader, and he's dealing with litigation expertise more than 35 years, and dealing with so many litigation. Also, he gained experience with human beings, and he's an expert in rising the energy in the relationships. And thank you so much, Malcolm, being here. Malcolm is vice president of the Beverly Hills Bar Association. So thank you so much being so supportive and being also present when we need your support in our webinars. So Malcolm, please take over and go ahead with our webinar with our panelists.
Well, thank you, Andrea, and I want to thank you. I see the hard work that you put into the Wellness Committee, and so it's my pleasure to help and to support. And just by way of background, part of the reason why I'm committed to that is that I've been practicing law over 35 years, and I watched the development of our Bar Association requirements for additional, let's say, recognitions of the challenges that we face as lawyers through our additional CLE requirements for substance abuse training and other things that lawyers would use as tools. Also, as a partner in a law firm, we are keenly concerned about that, making sure that we don't have young lawyers who are burning out, that you have the partners who have life challenges that are being supported through that process. And I watched the evolution and participated in the evolution of different types of employee assistance programs and mental health programs that were meant to help those lawyers. That brings us to today's event. I introduced Stephen to Andrea and Alina because Stephen and I we were, I guess, a good way of putting it is we were network buddies to begin with. And then after being network buddies, we became friends. And in fact, as Stephen got his company, his successful company started, Veritas, he came to me and we had meetings talking about the different kinds of things that might be integrated into a program. Stephen's best experience has been, I think, with working with and focusing on medical professionals, but professionals in general share many of the same challenges. And I understand that next month, Stephen will be starting a program designed specifically for lawyers. And Steve, I guess I would like to start on a personal note. And welcome, Stephen, and thank you for being here.
Pleasure.
I'll start on a personal note because what I wanted to say is the reason why I think you and I became pretty close very soon is we were both close. We started talking about personal experiences, and I had asked you what was the passion, because I saw the passion behind starting Veritus and wanting to help other professionals. And I understand that you've had a few challenges of your own, which is what led you to this field. Would you like to perhaps tell the audience about that?
Sure. First of all, thank you, Andrea, for asking me to participate in this webinar. It's an honor to participate. And, we launched Veritas the end of last year, and it's a virtual treatment program. And our first program was specifically designed for physicians and nurses that are struggling with drugs, alcohol, and trauma. So we've been quite successful over the past few months getting that program off the ground. But the reason I got into that business is, I'm a recovering drug addict and alcoholic myself, and I had a very challenging issue with drug addiction. I'm a New Yorker, and 2004, I had a very successful business where I put in executive benefits at large law firms, some of the largest law firms in New York City. In 2004, I started to develop a significant cocaine addiction, and over a 5-year period of time, really ruined my life and ruined the business, ruined my professional reputation, and bottomed out pretty badly. And I did a bunch of treatment programs throughout the country to get the help that I needed, and ended up relocating back in Los Angeles. And I went back to my old career of working in the insurance business and the employee benefit business. And a few years ago, I kind of just hit a wall. I was depressed about the work I was doing. I'd lost the passion for the work I was doing. And I really wanted to find a way to use my experiences as someone with a significant mental health problem and the journey that I had as an executive in corporate America with a drug addiction, and see if there are ways I could give back and do things differently. When I started reflecting upon this journey, there were several things that became very obvious to me. Number one, how challenging it is to talk about mental health in the workplace. I mean, there's such stigma around these issues. I was an executive in corporate America, and it was so uncomfortable, and there was so much misunderstanding that for most of my journey, I just hid in the shadows. I wasn't going to use company-sponsored resources. I was not going to talk to my colleagues. I was going to complete all of this in complete privacy. So it was really difficult to talk about these issues. The second thing that became very obvious to me was that this whole idea of like one size fits all treatment doesn't work. I really started thinking that, we treat addiction and substance abuse in this country like you've been in a car accident and not like you have diabetes, right? Addiction are chronic progressive diseases. And so I really thought about, are there ways that we can look at addiction and look at substance abuse differently for executives, where we can really provide resources that are coaching and clinical on the same team, but providing treatment over longer periods of time. And then the last thing that became really obvious to me was just how inconvenient and how challenging it is outpatient treatment for an executive when you live in big cities. I was living in New York, I was living in Los Angeles, and it was so challenging to get to and from a treatment provider. I found it so, my confidentiality was constantly being put at risk when I was walking in and out of these programs. I started thinking a few years ago, why can't we embrace telehealth? okay, to use to deliver clinical treatment services. And this is all pre-COVID, by the way. So, I got together with some partners and we really started thinking about how can we create something very specific for lawyers and very specific for physicians that are dealing with drug or alcohol problems that embrace technology. Kind of led us to where we are today.
Well, that sounds like quite a journey, and it's a multi-year journey. It's not a journey that takes place and is finished overnight. It's a process, not an event, I'm sure. Tell us a little bit about the commonalities that you've noticed. In other words, in connection with oh, by the way, let me jump in real quick and tell our viewers and listeners that we do have the ability for Q&A. If you have any questions that come up during the process, let us know. We'll keep an eye on the Q&A and we'll make sure that your questions get answered. And we have a few minutes at the end of the webinar to respond to those. But back to my question, I was asking what commonalities have you found in terms of the kind of stressors that lead professionals to these types of to resort to either drug addiction or some other kind of substance addiction?
Well, the legal community, depression, anxiety, and substance abuse are serious issues. And lawyers experience substance abuse, depression, and anxiety significantly greater than other professions. And the same is true in the medical community with physicians. And you have to ask yourself why. And even before COVID, the legal community was starting to create a lot of awareness around these problems. The American Bar Association started a mental wellness pledge. I believe your firm, Malcolm, was one of the original signers of that pledge, realizing how significant an issue it is for substance abuse and mental health issues and burnout for lawyers in the workplace. And some of the resources that they're committed to providing is education and awareness, early intervention, creating resources that are equipped to deal with lawyers with drug or alcohol problems, and having less alcohol at law firm events, and really using this pledge as a way to recruit and retain key talent. So even pre-COVID, the legal community, the big law community anyway, was starting to get more and more proactive and wanting to address these issues. And so one of the things you ask yourself is, why are lawyers more prone to these conditions? And, I can say just in executives in general, so many of the personality traits of a highly functioning executive that lend itself to being very successful don't necessarily lend itself to being at peace and being at serene and having good relationships in your life. You look at obsessive compulsive personality traits, narcissistic personality traits, lend itself to high rates of substance abuse and mental health issues. And the other thing that's really interesting in the legal community, Malcolm, and you can opine on this better than anyone, there's a high level of dissatisfaction with lawyers the first 10 years coming out of law school and getting into the legal world. And that dissatisfaction is an accelerant to burnout and fatigue in the workplace. So that's another big issue as well that the legal community has got to find a way to address.
Can I ask you something? Sorry.
Please go ahead, Andrea.
You mentioned, Steve, about lawyer stigma and the fact that they are in the denial state. And I'm curious, when is that momentum? Because I know they want to show that they're very strong and they avoid showing their weaknesses. So I'm wondering, from your experience and doctors and lawyers in general, it's the same with this stigma of having, showing confidence and being strong. When is that momentum when they realize, when they are motivated to step into this journey?
It's a great question and a great problem. Similar to physicians, lawyers have professional licenses. And so I could just tell you what my experience has been over the past year dealing with physicians. The stigma around mental health in the medical community is so severe that physicians in particular will not voluntarily seek out treatment until there is a massive crisis. crisis, where either they're mandated to treatment, whether their career is on the line, and where it becomes not only a risk to one's health, but also a public health risk, an impaired physician in the workplace. And what we see with lawyers as well, many of them have a fear of seeking out help for fear of risk of losing their license. Whether it's rational or not, there's that barrier to entry where lawyers will not use the resources that their law firm provides until there's a crisis. So you have to ask yourself, how do we reduce the stigma? And how do we provide education and awareness so people can get help prior to there being a crisis, where you have a much more higher likelihood of addressing these issues successfully? So it's a challenge across the entire legal community on reducing the stigma around substance abuse and mental health. Well, we're talking about drugs and alcohol here, but how many lawyers out there are open to talking about their depression or anxiety? As if they're going to be judged as who they are as a human being or who they are as a lawyer. So the answer is I don't know how you change that other than doing exactly what we're doing right now.
Well, I want to bring Alina into this because I had an interesting question. As you know, I've read the book that you ladies wrote called "Be Different," and I've done a lot of coaching myself through my career. And when Steve's talking about the work that he does through the telehealth services that are provided, there seems to be a dichotomy between coaching and therapy. And Alina, would you want to tell us a little bit about what your views are on the differences between coaching and therapy?
Hello, everyone. Yes, thank you so much. And of course, this topic is so important for me because, as Steve said, he's a recovered drug addiction. I'm a recovered burnout lawyer. I'm lawyer. I'm still practicing law in a bar association in Europe, but I'm also a psychologist because in the meantime, always I study personal development, and in the last year I studied psychology, clinic psychology, hypnotherapy, and coaching. And the point when I felt that I'm burned out, I was so lucky because I had already the personal development tools that I start to use it right away when I felt that I'm going to another direction, and I stop in the right moment in my life. And in that moment, I start to go more in this my new path as a psychologist and coach. And of course, I've been also in a position of a client for a therapy, a position for as client for a coaching. And after I become a psychologist, clinician psychologist, and coach, and I'm having clients in the both way. But lately, I'm specialized in coaching for lawyers because I know how it feels to be a lawyer. I know how it feels to have these disorders in the behavior as a lawyer, and that's why I can help lawyers better. So as answer to your question, Malcolm, therapy focus on a mental health, life coaching focus on a goal. So it's always important to be, especially in our profession when we don't have so much time. I discovered that lawyers like more, and it's more efficient for lawyers to use coaching, because coaching it's a vision of the future. Therapy goes in trauma, in all that feelings that hurt somebody. But as I have two possibilities, I have the tools to get the client and directly the behavior in the right direction. I mean, especially it's so important to focus on changing behaviors. So we have to be aware that our mind guides our action, and our actions basically is our life. So that's why I choose coaching, and I'm helping lawyers through coaching programs. And we are making coaching tailored programs for lawyers, because everyone is unique. And we have to, it's analyze of the behavior of each one. And it's not like a program from everyone. We have also programs for in general, but it's so important to understand why somebody it's in a burnout state, or why somebody is in anxiety or depression. What is his or her why?
Understood. Well, Stephen's answer is what made me jump in to ask you that question, because if we were trying to say or answer Andrea's question earlier of where is the point where an individual realizes that they need the therapy, maybe if they had coaching ahead of time, that coaching would help them with a goal, and that goal would help alleviate some of the other, let's say, symptoms that end up leading us to an addiction.
Well, Malcolm, there's also another point here that I think is important to mention, is that there's a lot of data out there that supports that coaching is a less stigmatized solution to getting help. There are all of these psychological barriers to working with a psychiatrist, working with a psychologist, quote unquote treatment. But what we're seeing, especially with executives and professionals like yourself, you've worked with coaches in a bunch of other capacities in your life. And being able to work with a coach that may have a mental health background, maybe a softer, less stigmatized solution to begin the process of getting help, which we think is critically important.
I fully agree with that, because that what I watched over the years is that for those listeners and viewers who are old enough to remember, back in 1972 when McGovern had chosen his running mate. His running mate initially was Thomas Eagleton, who had I believe it was the electroshock therapy treatment, and it came out and everybody was shocked, and he fell from the ticket. Well, that was 50 years ago, and we still have some of those stigmas that still attach today. So I think the idea of finding an entryway to therapy that is less, like as you said, less stigmatizing is certainly something that will allow people to explore it more without worrying. I know from my own experience, having represented lawyers before the state bar who have had drug addiction problems, and also doctors before the medical board, I think our professional licensing associations can do a better job of dealing with people who do come forward too, because there's such a fear of putting somebody out in the workplace who may have admitted to such an issue, and that they're challenged by it and they're trying to help, that they could do a better job at the licensing level too. But I wanted to go back to that comment that I wanted to talk a little bit more about specifically what you do. Steve, tell us a little bit about, you were talking about the geographical challenges. Yeah, absolutely. And in this age of Zoom and Microsoft Teams and WebEx and all of that, it seems like it's, by the way, I had recent shoulder surgery, and my next appointment with the doctor is via telehealth. I saw him live yesterday, and I said, when will I see you again? He said, you'll see me on TV in 2 weeks. So the point is, tell us a little bit about how Veritus has found a way to deliver its service.
Well, it's a fascinating time, right? So a few years ago, when we were designing this program, and I would talk about using video conferencing to deliver clinical and coaching treatment services for lawyers and doctors with drug or alcohol problems, people would look at me like, turn their head, like, a dog gets confused, and they just didn't understand what the hell I was talking about. And what we thought would take 3 to 5 years to get proof of concept took 3 to 5 months with COVID. So last March, with the shutdown, what ended up happening is the entire mental health treatment field shifted to a telehealth platform out of necessity. And so we're a year into this right now, and there's fascinating data that's coming out right now. So the end of last year, the Betty Ford Foundation and the Mayo Clinic both published white papers on the use of telehealth to deliver clinical treatment services. And here's what the data supports. The data supports that virtual treatment produces similar types of results compared to in-person treatment. Pretty interesting, right? It supports that there's higher clinician and patient satisfaction. Patients are staying in the program longer, and patients are more inclined to be honest on a virtual platform like this than they are in person. So when you think about the ease and convenience of using video conferencing that's HIPAA compliant to deliver services, and the fact that you can deliver services as a fraction of the cost compared to a brick and mortar model, in a post-COVID world, telehealth is going to be around and it's going to thrive. Now, there's an onslaught of issues that still have to be figured out: insurance reimbursements, state jurisdiction, licensing requirements. So we're very much in the infancy of this. But what we have noticed is that there's a real unique opportunity in time right now, from my perspective, in that we are in the drug and alcohol treatment business, to create programming very specific to lawyers and very specific to physicians, because peer support is so critically important when someone's recovering from drug or alcohol abuse. So having lawyers in groups with other lawyers is very therapeutic because of the similar journeys they have, because of the similar issues they have with having a professional license. Giving them a platform to receive treatment together with your peers is critically important. And you can do that with telehealth in a way you could never do that with a brick and mortar model. In the past, if you wanted to receive treatment with your peers, there are programs out there, residential treatment programs, where you can go away for 30, 60, or 90 days with your colleagues and peers. But that's a very costly way to receive treatment. It's also a very disruptive way to receive treatment because you're leaving your family and you're leaving your work. Now, my addiction had reached a point where I had to go away for a period of time and just kind of shut things down. But the data supports that about 30 to 40% of lawyers that are dealing with drug or alcohol issues, the more appropriate form of care would be an outpatient treatment program. Okay, but now that you can get them doing programming with their peers using telehealth, we think that platform is going to have real success moving forward. So we're really excited.
Well, going back to the title, I just pulled up the title: Mental Health Solutions for Lawyers in a Post-COVID World. That's the theme of this program. So is that what you suggest? Is that in a post-COVID world, what you've learned that has accelerated from a 3 to 5 year timeline to a 3 to 5 month timeline is now something that's going to stick? Which is the first question. But before you answer that, the second question is, how does one get started? Let's say we have a listener right now that says, this sounds really good, but I don't know where to go, who to call, or what I should do.
So the answer to the first part of your question is, from a treatment industry perspective, everything's been turned upside down. So we have lots of conversations with what the world might look like in a post-COVID world, but there's been such positive experience with the use of telehealth to deliver clinical treatment, especially for professionals that are very busy. So if you're eliminating commute times to and from an outpatient treatment facility, if you are eliminating having to leave your home or family for significant periods of time, if you can get a high quality level of treatment using this type of platform, it absolutely has staying power. So the answer to that is yes, especially because you have greater reach and you can deliver treatment at a fraction of the cost. So 100%, this platform will continue to thrive in a post-COVID world. And the second part of your question is how do you begin, right? So there are enormous resources out there that one can tap into if you're dealing with a drug or alcohol problem. I mean, you can get my information from Andrea, and you want to have a confidential conversation with me just as a recovering drug addict to get some insights as to what. I'd be more than happy to have a conversation with you around that. But if you even go online, there are so many communities out there that are confidential, are anonymous, and a good starting place to get some help.
So the question is, the resources are there, get out there and go check. And if somebody, have you had any experience in your business? Let's say somebody is presently in therapy. Let's say they're presently talking to to a therapist somewhere, and they're afraid of approaching that therapist for fear of alienating the therapist or something, and says, I'd like to do sort of a combination of telehealth and continuing working with you. Is that something you've experienced? Is it something that's happening? In other words, as opposed to an exclusive arrangement one way or the other?
Yeah, you bring up a good point. There will be hybrid models in the future, because there are some benefits to doing work in person, especially family work in person. So we envision there to be a world where there's both in-person and virtual treatment going on simultaneously. And also keep in mind, we get this a lot, around the medical community anyway, where as a treatment provider, we are not mandated to report a physician that's dealing with a drug or alcohol problem, nor are the physicians who are in our programs mandated to report someone that's dealing with a drug or alcohol problem. So lawyers in particular have professional licenses that they want to protect, but when you are in a treatment program, there are no rules out there that mandate that we need to report you to some type of governing body if you're seeking treatment.
I want to turn to Alina for a moment and ask the same question, but from a coaching and therapy perspective. But before I do that, you raised a point earlier that I think a lot of people are thinking about, especially now because of challenges in COVID for a lot of lawyers, especially in the small firms. They're struggling because of cash flow issues and other things that are heaped on top of the normal pressures of the practice. So one of the first things I think they would ask is, how much does this cost, or is this covered by my insurance? How have you been able to price your model, and what has your experience been with insurance companies recognizing that the services should be covered and should be paid under the typical provisions under a policy?
It's a very interesting question. So we've had a lot of challenges. So, telehealth and telehealth reimbursement when it comes to substance abuse treatment is new. And so a lot of policies that we're coming across don't even have telehealth provisions within the contracts themselves. There have been a lot of laws that have been passed during COVID, parity laws that will say you cannot reimburse less for a telehealth treatment versus in-person treatment. So there are laws out there, but this is such a fluid marketplace right now, Malcolm. Who knows where this is going to end up? So right now we have actually struggled with insurance carriers, and which is really unfortunate right now, because in many states with the COVID lockdowns, you're prohibited from doing in-person treatment. A lot of insurance companies have been denying claims or have been reimbursing a fraction of what they would compared to in-person treatment. So it has not been an easy go from our perspective in getting the reimbursements for telehealth versus in-person treatment. So I think over time, this will have been figured out. The other problem you have, Malcolm, is that with COVID, there have been waivers of state jurisdiction licensing requirements, which means that we're a treatment provider in New York. We have a patient that's in New Jersey. In theory, you have to be licensed in the state in which you're providing treatment. You have a medical director, a clinical team that is licensed in which the state of what the patient lives in. But with COVID, there have been a waiver of state jurisdiction issues, allowing for broader reach. These emergency powers have been put in place. But the insurance carriers have not necessarily gotten on board with that. So it's been somewhat frustrating to date. But I imagine over the next few years, because you can deliver treatment at a fraction of the cost using this technology, we think over time, the insurance carriers and providers will be big supporters of this platform.
I was going to say, and like your experience between 3 to 5 years to 3 to 5 months, I think it'll accelerate. It won't take that long. I think I'm already seeing some of the discussions regarding a business decision being made by carriers to include things that may not by its explicit language be included. But you and I should talk about that offline.
Sure.
Alina, let me turn to you for a second. It's sort of the earlier question to Steve, which I'm going to which I'm going to reverse a little bit, and that is, have you had experience in providing the coaching that you've outlined for us earlier at the same time that your client is receiving therapy for some other issues in their lives?
Yes, sure. I had, and it's very, very interesting question, because even the clients, they don't know if they have an issue, mental health issue, or it's just a behavior. Because let's take as example anxiety. Anxiety is not always a mental health issue, because having an anxiety and with panic attacks and the fear of going out of house, it's an issue, and that it's a mental issue, mental health issue. But having a panic attack or having an anxiety because of the deadline of the clients and a problem with the family, and not knowing how to deal with your life, this is not a mental health issue. This is just an anxiety because you don't have clarity in your life, in your mind, how to organize your thoughts and your behavior. Because for us, for lawyers, mind, it's everything. If we are not taking care of our mind, it's our laboratory. I mean, everyone in the future, I think, is going to be like mandatory for lawyers as for doctors to take care of personal development, coaching, and being aware where they are in the certain moment of life. Because I saw clients, they seek for need, for help, but it wasn't a problem of mental health issue. It was just a problem of confusion, too many deadlines, behavior, clarity. They don't know the difference between mental health issue and just disorder of behavior disorder. So in this case, when we have our programs, we make this clarity, and people understand where they are in life. And this is so important, because you have insights when you see some programs and you are part of the group where you see and you hear another story to another people. You see yourself in that story, and you know where you are, and it's a good start to begin to do something for yourself.
One of the questions is, do you see a difference? And I'll throw this out to both you and Steve, to both of you. Do you see a difference between the kinds of anxieties that lead to, let's say, other disorders in life for professionals in their beginning stages of their career, in their 20s or their 30s, versus if they're in their 50s and their 60s?
Yes, sure. This is first of all, anxiety. It's a symptom that all the in DSM, if you go, you see the anxiety is like a general symptoms of many mental health issues. So if the anxiety is changing in time, and the client sees something different, they can go to the therapist, to psychologists, to psychotherapists, to discover more and to see what is the reason. And basically, it's something related to the trauma. If we are talking about the young lawyers, because young lawyers, they are starting the career in a very difficult time, where it's very hard to find clients and to start a new life. And there, it's a very important moment in their life, and coaching would be great tools to start right away in starting the career. And trauma and the past story of the client is so important for therapists. So depend where they are and how they feel in the process, in the path of this career.
And let me go back to you, Steve, regarding some more nuts and bolts of the process. I think because that's what a lot of people like to know too, and that would a telehealth program of let's say consultations and visits telephonically or via internet and so forth, would that mirror a typical arrangement that you would have with a therapist, where you'd see them once a week or twice a week or twice a month? Would it be the same, or do you find that it requires a different level of connection and connectivity between the therapist and the patient or client?
So I can share with you from a drug and alcohol treatment perspective what we have done. We have literally mirrored the programs that were in place in person to a virtual platform. So the program we have out right now in the market for licensed medical professionals is something called an intensive outpatient program. So for someone that's dealing with a pretty significant drug or alcohol problem, it's 10 hours of clinical treatment a week, which consists of three-hour groups, one individual therapy and one coaching session. And the program is designed to be for 12 weeks. So we have completely transitioned the exact in-person treatment experience to a virtual platform, quite successfully. But that's for a very specific type of person that is dealing with a significant drug or alcohol problem. So we've kind of, but the other point you alluded to also is where we've had to do some training is for clinicians. Clinicians themselves and coaches themselves learning how to use this type of platform in comparison to being in person. So some of the basics are obvious, right? You can't smell alcohol on someone's breath on this type of platform compared to when you're in person. You can't look at their disheveled into how they look. And so it's been, clinicians themselves have had to train themselves differently, asking more probing types of questions, because you're not having the same interaction in person. But what's also very interesting is clinicians also are getting a look quite often into people's homes. So really interesting perspective that they're able to get that they weren't able to get with someone coming to your office. You can see if the house, how disheveled the home is. You can see if there's disruption going on in the home or office. You can get some insights into someone's life that you weren't able to do coming to you. So there are trade-offs with everything. So it's just fascinating.
Sorry, I want to tell you a very interesting story relating on this, because I had a client, he's a lawyer, and he told me, I feel better when we are having Zoom coaching than having one-to-one. I feel more open. Because he's in his habitat, and he feels more confident and more free to express himself and to have the safe place to express. So this is very interesting, and I think for many people, it's very important to feel safe, and home and your habitat, it's giving you kind of safeness.
I think it's, and I would venture to say, I will analogize it to being a litigator, and my practice is sort of to use a phrase, schizophrenic. Half of it's in litigation, half of it's in transactional. And on the litigation side of it, a lot of our litigators have been cautious, have been wary, suspicious, and now elevated to a different level, cautious about the arbitration, court appearance environment for exactly that reason, that I, as a litigator, I will tell you, yes, I like the idea of seeing the eyes and watching the demeanor of a witness on the witness stand, rather than not necessarily getting a full view on the screen. And you don't also see the reaction of a judge or an arbitrator and the reaction of opposing counsel to evidence, etc. But the way we're coming down on it, by the way, I mediate for the federal court. I've had 3 mediations that I've done. And in all 3 of those mediations, they've been successful. I've settled them. And I was the biggest skeptic that I could ever get people to settle and come together in a virtual environment. And I think that's part of the evolution too, is that some people will be very comfortable, as Alina pointed out, in their own environment, and other people will be distracted by it. And I think it's going to be up to the health professional. It's just like us. If I'm feeling that something's distracting in the legal community, I'd have to tell the arbitrator, Your Honor, this isn't working because of this or that. So I think it requires us to be even more alert in that, like you said, more observant, more alert, more with it. Watch what's going on. Watch how are they taking it seriously? Is the witness taking the fact that we're on a tele-legal environment? Are they taking it seriously, that they realize they're in a courtroom even though they're on TV? So I think all of those are part of the evolutionary things that we need to be concerned about. Steve, tell me a little bit too about your what is your website, first of all? Can you share that with everyone?
The name of the website?
Yes.
I think it's to put in the chat, both of you, to put the websites for the audience. They can find the.
Yeah, that's it. That's a great idea. Do that. Put it in there. But you can the short stories. Yes, please do. And you talked about different programs. Are those outlined on the website?
Well, the current program for the licensed medical professionals, doctors and nurses, that's on the website itself. Next month, we'll be launching our lawyer program, which is really exciting. So it will be updated to reflect that as well. If anybody's on this call and just has an issue and wants to chat with someone, I'd be more than happy to have a conversation with you, just one person to another. I'm a good listener, so please feel free to take advantage of that. It's interesting. We were talking a little bit about a few other things that came up with both of your conversations. One of the things you have to be careful, that we've had to be careful of, is clinician and coach burnout using this platform. What we've noticed is that clinicians have to have uber focus in this type of platform, and coaches have to have uber focus using this type of platform to look at cues and to read body language and really pay attention. And that the fact that it's so convenient, coaches and clinicians can literally see twice the amount of patients they were seeing in a day. So we've had to be very careful with clinician and coach burnout, making sure that they take care of themselves. There's also been a high rate of clinician and coach mental health issues, surprisingly, over this past year, as their focus has been so involved in helping others, not taking care of themselves. So really important, the health of our clinicians and coaches with this platform taking care of themselves.
Sorry. No, I was saying you can give something from your empty pocket. So it's the same as lawyers. They have to invest in their mental health in order to support clients. So yes.
That's correct. And clinicians and coaches are no different. So easy to naturally for many great clinicians and coaches to take care of others, but so important in today's day and age, especially with this technology being used daily, to take care of yourselves. And then the other thing I was thinking about, in this kind of, as we come out of COVID, and just thinking about the challenges of social distancing, the challenges of isolation, and just how important human connection is. And, it's interesting, I've been very active in Alcoholics Anonymous for 10 years. And over this past year, so I've been doing virtual AA meetings for the past year, with consistency. And I'm so grateful that it has been made available through Zoom. But I can tell you right now, I cannot wait till we get back to those in-person meetings where you can actually give someone a hug, you can get a cup of coffee before or after, the kind of human connection that I think I personally yearn for. Doesn't necessarily lend itself in this platform. So I don't think we're going to completely replace human connection and human interaction, especially, Malcolm, even like conversations we had, like what will the new workforce look like with office space, virtual and non-virtual? I mean, it's very difficult to replace human connection. It's very difficult to build culture on a virtual platform compared to the in-person experience.
Can I say something regarding, because you were talking before this difference and how they approach also Malcolm, you said they don't take seriously. And I noticed that this with telehealth and this virtual approach, the tendency is to cover emotions, because behind the screen, you don't expose all emotions. You are not exposed 100%. So yes, this is a big challenges for coaches to read the body language, as Steve said, it requires a lot of attention, and you don't have 100% I mean, the result is not 100% because there are a lot of hidden emotions, and you have this opportunity because it's a screen there, and you know something you can hide over there. So yes, I hope we go back to normal soon, and we can take accountability and to assume our emotions. And I think this period of time, it was a good period of time to be in touch with our emotions. And now when we go out, if people are not open and they are not ready to expose and to assume their emotions, I think it's not the way. I mean, it's going to be back like before. This is our opportunity to jump into our truth.
Well, I fully agree with that. And I think what we have to be careful with, what aggravates me when I read people talking about the so-called new normal, et cetera, is they swing in one direction or the other and talk about, for example, the demise of the office environment, like it's never going to come back, et cetera. And I'm like, no, that's not true. I'll tell you, speaking, we're very, very meeting focused on Microsoft Teams and having our groups meet, et cetera. But everybody yearns for what Steve was talking about earlier. And yes, there's going to be a hybrid. Speaking from my practice, I was traveling, as you know, at least 3 or 4 times a year. And that travel was required by the, let's say, the subjective requirements of clients and transactions. The good news is that's been alleviated now. I have clients that are now used to using Microsoft Teams. And by the way, speaking of burnout, I was like 7 a.m. to 7 p.m. on the phone because everybody was going through the COVID problems of landlord-tenant issues and, PPE and PPP and all this stuff that was happening. And I was fielding all of this, and I was feeling a little bit of that burnout, if you will, until I started organizing my schedule better. So I think what's going to happen is that the new normal is, I think that people's expectations are going to be a little bit different. They're going to be more comfortable in this environment, but this environment's not going to replace human touch, human contact, and human interaction. It just cannot, because we're humans after all. That's my editorial comment. So.
Malcolm, yesterday I was listening to a podcast, and they mentioned that lawyers' suicide rates are on the rise, and it's really disheartening when you hear that. So I think about people listening to this webinar right now. It's so important to realize that you're not alone. There are people out there like me who have suffered the way you have suffered. And there's help out there today, and there should be no shame in asking for help. For years I struggled because I thought asking for help was weakness, and that's bullshit. Asking for help is the greatest sign of strength. So I want to mention that on this call right now because I understand, and something, me too. So for anybody on this call right now that's struggling, there are resources out there. There are people out there that understand. You are not alone. There's help out there, and people do get better.
That's an excellent message, Steve. And I just want to reiterate what you said a few minutes ago. If there's anybody that feels that they can use the help and assistance of somebody to speak to, you're available. And I know that you're sincere in that. Let me see if we have any other questions as we're about to round out the hour. And then what I'm going to do is I'm going to propose that everybody make a concluding statement. No, I think we've answered that. And in the chat, for those of you that are interested, there are the websites for both Elevation and Veritus, so you can look at those resources when you get off the webinar. So, concluding statements. I'll start with you, Lena, since ladies first. I always, that's my rule. So go ahead.
Yes, thank you for your kindness. Because I was thinking of coming to the normal. The normal, we don't know what normal is gonna mean in the future, because they says we need 21 days to change our behavior. We already changed our behaviors because we are in this pandemic, a new behavior since, almost 1 year. And we already changed our behavior, and online Zoom relaxation and distance, and going back to the normal is not going to be a real normal, because we need also to gain trust and safeness, being in connection with other people, because already in our mind it's that being too close, it's a danger, and the people is going to be in a fear. So this is very, very important moment when people need support, and they have to be aware that these confusional changes from one behavior to another can damage our inner state. So that's why I offer also for the people who are here today in our webinar, I'm willing to offer my free strategy coaching session. So please, to all attendants, feel free to reach out to me, and because I put my email there, and please ask for support. I'm very happy to give my support, and I wish to everyone to take care of the mental health, because mental health is so important, like our heart health, like our liver, like our brain. It's so important, but this attention of our mental health is not too much in our awareness. We go to check up every 6 months or every year our internal organs, but not our brain, not our behavior, not our way of interacting with other people. Being your observer and seeing how you see, how do you, your thoughts, how do you think, how do you believe about yourself. It's a request of doing an inner clean every day, I would say, but to check in, it's so important. That's why I give you guys my email, and feel free to reach out to me.
Thank you. Just Steve, you should put in the chat to all attendees your email and website information. Alina, it was initially sent out to the panelists, but I see that we've had one of our helpers at the BHBA that sent it to all attendees. Just keep an eye on those things. But while you're doing that, Steve, a concluding remark from you.
Sure. So, this was awesome, and thank you for allowing me to participate. And so I guess a concluding remark would be a call to action. Substance abuse and mental health in the legal community are serious problems that are not going away. If you're a leader, you can no longer turn a blind eye to these issues. We need to empower leaders with solutions and strategies that they can bring back to their organizations that help reduce the stigma around mental health, allowing their lawyers and employees to feel safe enough to ask for help earlier on in the process. And we need to come together. I was in New York, downtown New York on 9/11, and very traumatic time for New Yorkers, myself included. And the months after 9/11, New Yorkers came together with a similar type of trauma bond. And you weren't, your race, your religion, it didn't matter. You were a New Yorker. And what I'm hoping is going to happen in a post-COVID world where everyone has experienced some form of mental health issue because of the isolation, because of the social distancing and disconnection and disruption, that we're starting to have empathy, and the stigma around mental health will reduce. So if you're a leader on this call, you have a responsibility to educate yourself around solutions and strategies around mental health. It is so critically needed today for our leaders to lead in this area.
I'll just add to that, by the way. Do you know what makes good business sense too? People have good confidence. They can feel it. I can say that from the business perspective, prior to the law firm perspective, they realize that preserving existing assets and encouraging better performance through self-awareness, et cetera, is a better thing to do and is more effective and more efficient than trying to renew other resources and discard existing resources. So I fully agree. Well, with that, I will turn it back to Andrea since you opened the program. Would you like to close the program, Andrea?
Yes. First of all, I want to thank you to all you panelists for your time and energy and your generosity being here for lawyers and for all work-life balance members. This is such an important moment, and I know you are all busy and taking your time. I really appreciate, and it's a real privilege because I want this committee to be like a point for all lawyers when they seek support, when they need the community, when they need something to cope with and to find the resilience place. So this is my goal in this committee. So I put my email there, and I invite all the lawyers, they are seeing us now, to reach out to me and to become members and to share with us what are their needs and how we can help them. So Work-Life Balance Committee, it's open for all you that you need this kind of support. And thank you so much. You panelists, encouraging lawyers to seek for support. And thank you, Beverly Hills Bar Association, for this support. This is a very important time, and to be together and to make a difference in starting from ourselves and after helping others, because you have a big responsibility toward others. So thank you so much again. And
let me jump in with one thing. As everybody is volunteering their time and attention, I'll give one. I think everybody knows how to get a hold of me. You don't have to put me in the chat necessarily. But to those law firm leaders who may be out there that feel that no matter what size your firm is, whether you're 5, 10, 20, 30 lawyers or more, if you would like to speak with me regarding some guidance on how to implement these programs or how to accelerate the awareness among the members of your firms, or if you're having an issue along those lines, I can give you the benefit of my experience as to what I've seen over the last 35 years of evolution of law firms dealing with and helping their colleagues and through these tough times.
Thank you, Malcolm.
Thank you. That was wonderful.
Thank you all. Okay. Have a wonderful weekend to everybody.
Thank you. Have a wonderful weekend. Bye-bye.
Bye-bye.